Good afternoon, everyone. Thanks for taking the time to be with us. On behalf of the five-star accredited Fort Bend Chamber of Commerce, I want to welcome you to this webinar. My name is Mike Dotson. I'm chairman of the Healthcare Division, and we hope you and your family are safe and healthy. Before we get started, I want to go ahead and acknowledge our sponsors: CHI St. Luke's Health Sugarland, CU People, Fort Bend Medical Society, Memorial Hermann Sugarland, Houston Methodist Sugarland, and Seyfarth Shaw. Now I'd like to introduce our speakers. Our first panelist is Salaria Fletcher. Seleria is the Vice President and Chief Nursing Officer at Memorial Hermann Sugarland. Previously, she held several leadership roles at the hospital where she was instrumental in helping lead the organization to achieving the National Malcolm Baldwin Award. She is currently leading the campus through their journey to the National Magnet Accreditation. She brings many years of nursing and healthcare leadership where she has expertise in organizational change, leadership, and strategic planning. She received her bachelor's and master's of science in nursing from UT at Tyler in Tyler, Texas. So welcome, Seleria. Next up is Joe Freudenberger. Joe is the CEO of OakBend Medical Center. OakBend is a $1 billion, 3-hospital, independent nonprofit community system serving Fort Bend and surrounding counties. Joe got his MBA from Tulane, after which he began working in healthcare with Deloitte Consulting. He worked with major healthcare systems around the country, helping with their business operations. He has 11 years experience as a CFO with 2 different hospitals, prior to 13 years ago taking over as CEO of OakBend. Joe is a recipient of the 2018 Houston Business Journal's Most Admired Nonprofit CEO. He also was the winner of the Ernst & Young Entrepreneur of the Year for the Gulf Coast region in healthcare in 2017. So again, welcome, Joe. And last, yes, sir?
I said thank you.
Oh, okay. I'm reading off a thing I can't see. So you're welcome. Dr. Elizabeth Torres is our last panelist. She is a native Houstonian. She graduated with her medical degree from Baylor College of Medicine and completed her internal medicine residency in North Carolina. Since 1986, she has lived and practiced internal medicine in Fort Bend. She's also a former board member of the Fort Bend Chamber of Commerce. Outside of being on staff at CHI St. Luke's here in Sugarland, she works with Methodist Hospital, HCA West Houston, and Memorial Hermann Sugarland, along with continuing her private practice in internal medicine. She's active and organized with the Texas Medical Association and the American Association, and also the American College of Physicians. So please join me in welcoming this esteemed panel. So we'll go ahead and get started, guys. So my first question is kind of just a general overview, and we'll start with Seleria, and then we'll move through the panelists. Really, I'd like for everybody to talk about COVID-19 and how it's affected their day-to-day. What does it look like with capacity? What precautions are being taken? What telehealth options are available? What is PPE looking like? And really all in, what should patients know before coming in your facilities? So with that said, Seleria, I will turn it over to you.
Yeah, absolutely. Thank you so much. It certainly has been a challenge for us, no doubt. I mean, there's no secret in having to look at our daily operations very differently. We are excited, though, that we're in a position now where we are ramping back up. And that's what we wanted to get back to, where we could get back to some sense of normal business. And with that, what we're looking at is we're moving away from those very, very strict guidelines we had for visitor policy. We're opening up that visitor policy somewhat to be able to allow visitors to come in and be with their loved ones. We are seeing ramp up in our surgical cases, so we want our patients to feel comfortable as they come back in, and those restrictions that were out there for us are being lifted. So we have the opportunity again to serve our community and our patient population. What you'll see, though, coming into the organization is some safeguard measures. And through those safeguard measures, we're taking time to screen patients, screen visitors. We've been screening employees from the moment that we started having the pandemic situation happening. We've been screening our employees. So visitors and patients and our community can expect those safety measures that we're actually putting in place. In fact, if you have it, I'll share with you just some of the procedures, if you don't mind, if you'll place that up about procedures and visits, send a little PowerPoint through that we can share with everyone. With that, we are doing things, and if you're able to see that, we actually have, basically we're redesigning the healthcare experience. We are having to take those safety measures that are going to be important to our community. We're looking at, again, a normal state that is different from ever before. We're redesigning things, and we're creating what we consider a safe wait protocol. And within that, that means that we're taking extra steps to make sure that our visitors and patients as needed, that they have masks on, that they have the appropriate amount of PPE for our staff, appropriate amount of PPE that's going to be required for our patients and visitors. And we're doing virtual visits. We were doing virtual visits prior to COVID for our stroke and some of our chest pain cases, but now we're using our virtual visits as even more an opportunity to connect with our patients within their homes if they're not able to get to the hospital. Our goal is basically to provide that seamless experience, even though it's going to look and feel a little bit different, but to be able to provide that seamless experience for our patients. The next slide just shares with you again some of the signage that you may see. Again, that is throughout the hospital, we are practicing social distancing. So as visitors enter our walls, again, they'll notice that we have signage up. And with that signage, again, is just to keep us all safe so that we can practice safely with keeping that 6 feet apart social distancing to help from a conference standpoint as well. And then the next slide just shows, again, some of the signage that we are actually going to be utilizing to reinforce some of the safe practices to help our visitors and our patients better understand where we are. But we are confident and feeling really excited to be able to see visitors and our patients, our physician providers, to be able to practice in the environment again. So some of the things that we commonly are seeing around the community is what you're going to see as well when you enter the doors of the hospital for the safety of everyone involved.
Awesome. Thank you. That was great. Joe, do you want to jump in and kind of address the same as far as OakBend Medical Center?
Well, I'm happy to do so. However, we've been in the research and development effort, research and duplicate. So whatever Memorial Hermann and Methodist and CHI St. Luke's are doing, that's what we're doing. So everything that Seleria described, with the exception of the really cool signs, are the procedures that we're following at OakBend. It's been a wild ride, as you can imagine, for a independent hospital. We don't have the resources sometimes that the bigger guys have, so we have had to figure out a lot of things on our own, had to source the personal protective equipment that was in short supply at the beginning of this crisis, figure out how to stand up isolation units for our COVID positive patients, figure out our protocols in the ICU and other areas of the hospital that have been affected by this, and to keep our staff safe and informed and trained. It's been an interesting journey. I don't want to repeat the journey, but it's one that has strengthened us and I think made us better capable of continuing to provide the services that we provide to the community.
Awesome. Thanks. Dr. Torres.
Hi, I wanted to reiterate what they're saying. Certainly the safe practices that have been put in place are something everyone's doing according to the CDC guidelines. But at the outset, in early March, we were just preparing for the pandemic, and we got the first patient in Fort Bend County. So rapidly, we had to make sure everything was in place to make sure that we were prepared to take care of this patient. The patient was there for several weeks and did very well and went home. But the preparation that our staff has put in from the very beginning has been what's paid off for us in the long run, because they now feel more confident in caring for patients. The patients are going to feel more confident in being in the hospital because our staff are more comfortable with the different constraints that we have wearing the mask. Certainly, we'd like to be able to smile and hold our patients' hands when they're having discomfort, but we're very limited in that now. And certainly they can't have their families. And that's been, for me, the biggest heartbreaker, is that not having people's families are with them when they're very ill. But the preparation that our physician staff and our nursing staff and all our staff, including environmental health, everybody has put in a lot of time and effort. We installed an incident command center at the very onset of this situation and have held meetings every morning. We just made it 3 times a week this last week, but we're having every morning so we know where we were as far as PPE, staffing, our patient load. Just today we had our incident command, and we have no patients in the ICU, and we have only 3 patients on the floor. We did develop COVID and non-COVID areas, as well as having extra isolation rooms in the ICU that we built out, as well as extra isolation rooms on the floor. So we're able to do that very quickly to be able to anticipate the load of patients we were going to get, and have been able to take care of them very well and very safely. But I think we're all trying to do the same thing, prepare in case there is another wave that comes. And we don't know when that's going to be, just like we didn't know we were going to have the first patient in all of the area. But we're as prepared as we can get. And I'm very proud of our staff and our physicians for being there and being ready to take care of the patients that came through the door.
So, Joe, you hit on it a little bit, so I'll let you have first stab. Financially, this is obviously affecting all of your operations. And what does volume look like, and what are you doing internally to sort of just weather this storm, and how has it affected OakBend Medical Center?
Well, it's been pretty crazy. When the governor's order precluding elective procedures was in place, we lost over half of our revenue stream. In a weird way, too, our ER volumes dropped between 40 and 50% per location. You would have thought in the course of a pandemic, you would be overrun with patients, and it was the opposite. So that was another part of our revenue stream that walked out the door. And while those revenue streams were walking out the door, the costs were not, because the costs in the hospital are more heavily concentrated on the inpatient side than the outpatient side. So while 50% of our revenues was lost, less than 30% of our costs were reduced. We had to furlough a number of folks in order to maintain our financial stability, and we're slowly bringing those back as our volumes increase. But it's not, we had hoped that it would be a sudden increase in volume, as everybody had been putting off health issues, but it's more of a slow ramp up as people get progressively more comfortable that they will be cared for in a safe manner that doesn't expose them to COVID-19. So we have fortunately been able to access federal subsidies that have made us, put us in a position to weather this storm. As long as volumes come back over the course of the remainder of the year, we're going to end up in okay shape. We'll be down, but we will not be seriously affected by it. So it's an interesting process. It's kept us up a lot of nights figuring it out.
Thanks for that. Dr. Torres, I'll go to you next with the same question, but also if you'll address, I guess, any fears that you have of what could happen in our populations if people are foregoing necessary medical treatments because of fear, or if there's a limited amount that can be done virtually if someone needs a shot. What is our pediatric patient base going to look like, and what concerns would you have in that area?
Well, certainly as far as financial impact, everyone's had a huge financial impact. The number of, about 30% decline in admissions, 65% decline in surgeries, 50% decline in ER visits, just as Mr. Freudenberger stated. So certainly we've seen the impact that's been huge. We all did get some federal monies to help, but certainly that's not going to cover the impact that we've had because it's been tremendous. We're trying to do what we can to conserve. We've had to furlough employees as well and trying to bring them back as our volumes continue. Certainly with the lifting of restrictions on outpatient surgeries, we've seen patients come in who could not further delay their surgical procedures anymore, and we've been able to do that safely. And I think the most important thing is that we're prepared in case there is a surge in the middle of us trying to ramp up, that we're still prepared for that surge, and we're holding our breath that we don't have to meet both challenges at the same time. But we know that our world is new now. We have to face COVID and non-COVID patients, and we'll have to take care of both side by side in a safe manner, and we're prepared to do that. As far as prevention, I know that, the future is supposed to look that we're going to decrease hospital admissions, that we're going to decrease hospitalizations because we're doing better job at preventing illness. I don't see that happening in the near future because this has put a big dent in the people wanting to come to the office. Certainly, I've seen that in my own practice as well, that impact of people reluctant to come to the office, despite the fact that we're doing social distancing, everyone's wearing a mask in the hospital. Every patient and every person in the hospital has to wear a mask. So we're trying to safeguard as much as we can, having hand sanitizer everywhere, cleaning as we should, trying to reassure them as much as possible. But despite all this, we still see people very reluctant to come in to get their physicals done, to get their pediatric vaccinations done. And I'm worried that we're going to see a resurgence of other illnesses because the children are not getting their vaccinations and patients are not getting their colonoscopies done as they should, or get their physicals, their lab tests done that's needed to monitor their chronic health conditions. So that is a worry. We're trying to do the best we can to reinforce the public. And I think we really, as all health professionals, we have to get that message across to our patients that we have created a safe environment as possible. We want them to come in and be seen and get their chronic illnesses taken care of, and not let it be a scenario where they have to go to the emergency room because they've not been attended to properly.
Awesome, thank you. Seleria, same question to you.
Yeah, I definitely would agree with both of our panelists. We've taken time to really look at financially what has happened. We certainly are not absent of the same losses that have been described. Billions of dollars lost because of the elective surgery volumes that have dropped. Definitely dollars lost from, just as you would think that, again, coming into the ED would still be a priority, but we immediately saw some drastic changes in just the admissions in our ED. And so with that, we were fortunate we didn't have to furlough employees, but we did have to be creative. We had to start creatively asking employees to perhaps have less hours so that we could generate work for everyone. We asked people to do roles that they probably had not done before in the past, but that was just to help us with these new screening stations and how we were screening patients. And so a lot of creativity from the team and our physicians, they really rose to the occasion. They did an excellent job with just trying to be flexible in that way as we begin to address our new norm, basically. But one of the things, again, that has been successful for us is as we begin to ramp back up, as our other panelists have described, taking time to really reassure the community that we're here for them, that we are taking measures and have been taking measures over the last several months to make sure that we can maintain the safety for all. We don't want anyone to stay at home that may be suffering from chest pain or stroke or any of the other illnesses that they perhaps had fear of coming to the hospital. We want them to be reassured that we have redesigned our layout. We've had to do that. We literally are redesigning layouts where they're 6 feet apart in certain areas, where we bring people in individually for their tests or their procedures, those kind of measures, so that we can let our community, let our patients, our visitors, our employees know that safety is our #1 priority. So a lot of work that has gone into where we've come from, but a lot more even going forward in our new norm. It's going to look different for us for sure.
Thank you. So I think all of the panelists have talked a little bit about how much work has gone into this and how unusual the situation represents itself to be. How are you kind of balancing the line of keeping your folks engaged and in using your labor resources, but then kind of making sure that folks are able to not be burned out, or be able to take some time to kind of unwind or get away from the stresses that the pandemic is bringing on? I'll start with you, Dr. Torres, on that.
So one of the things we've done is really try to keep an open conversation going with all of our employees, because I think quelling their fears, their anxieties, when we first started this, we had no idea about the extent of illness we were going to have and what impact it would have on our own lives and how we might be taking illness home to our families. And that's all been very worrisome. But trying to reassure our staff and talking to them on a daily basis to make sure they understand what the procedures are, that we're following all the guidelines as appropriate, and really keeping an open conversation with them. They put a lot of time and effort, and we've had people who were on a COVID-only unit who wanted to stay on a COVID-only unit because they felt comfortable enough to do that and felt like they wanted to volunteer maybe over people who might have other obligations, might have to worry about their families or something like that. But I think that the impact is really trying to make sure we have an open conversation, that they understand if they have any anxieties or fears, we're ready to answer their questions and make sure that they don't have any reservations about performing the tasks that we need for our patients, to be sure to take care of them in a safe manner.
Seleria, did you want to take it next?
Yeah. I mean, very similar to Dr. Torres, we were very fortunate. We have an amazing workforce that was very frightened, no doubt. They were frightened about, what does this mean? How does this look? But quickly rose to the occasion. And I would say that was from the front line, the nurse, the physician, to our housekeepers, to everyone involved, took a stance that we're here to help. We're here to learn. We listened a lot. There were tears. There were frightened individuals, but we took time to really listen to them, understand what the needs were, being sure that we were providing the resources that was needed. Our CEO, Melissa Patel, was awesome. And, the one thing that resonated with our staff is that she often would say, this is a marathon. This pandemic is a marathon. We can't think we're going to sprint to the end and it's over. We have to pace ourselves. We have to be okay with some of the fears that, come forward. We have to be able to talk about those things. We had an outpouring of community support, which was just amazing. Quickly, the staff began to see how wonderful the community was out there delivering meals and Girl Scout cookies and all kinds of things that really supported them, and it really gave them a sense of peace, helped them understand and appreciate all the wonderful things that they were trying to do for the patients while we were trying to manage fears. One of the things that we did, within our organization, we have a lot of wellness support. Our wellness support team would come out, talk to the teams, work with them. We have wellness rooms within the organization that we encourage our staff to take advantage of, and even employee assistance, because not only were we talking about employees dealing with COVID patients in the hospital, but they had their own families they were concerned about. And so we were managing in a much different way than we've ever had before. And that is managing the fears, managing the pride, lots of pride in taking care of patients. But it was certainly, it's been a wonderful journey for us. A lot of times you may have heard across the nation, this is the year of the nurse in 2020. And with that, pride was just coming out everywhere, which was just wonderful and awesome as we saw very afraid patients coming in the door, family members calling. It was just an outpouring of just compassion and courage like we've not seen before. We continue to have those conversations. Those things are still present today that we continue to support our teams as they work through caring for our patients every day.
Thank you. Joe?
It's really remarkable what our staff have done, both on the front line and in support of them. Our materials department has worked countless hours sourcing PPE from all over the world. It's been a Herculean effort. And to fully appreciate the challenges, it's a daily challenge with our frontline staff in particular, and our nurses and those who have to wear personal protective equipment in the COVID units. It's hot, it's hard, it's stressful, trying to manage the physical demands and simultaneously the emotional demands. I had a nurse tell me the other day when I was rounding, said, every now and then I have to just have a good cry and then pick myself up and go back to it. And she was, as Seleria was mentioning, she's proud of what she's doing, because if you chose to get into healthcare, now is the time when you see the virtue of that choice. But along with the COVID-19 challenges remain the challenges that we have always had. Patients with mental health issues that are difficult to care for, and the challenges of just managing the staffing and keeping enough people at the front lines to manage the load. It's a journey that starts over every day.
So Joe, you're obviously in a little different situation as the other panelists, and that you're a regional system. So a ton of your strategy comes from you and the leadership team around you. And a lot of this has forced folks to be extremely prepared, but reactionary, because you don't know what's happening day to day. How far out have you guys planned? And are you able to get folks together and even get to that level beyond just handling the day to day of what the pandemic has brought?
So our model really is to take the best knowledge that we can gather from organizations such as those in the Houston area and across the country, the Mayo Clinic and others, and take the best concepts that we can access from those models and employ them. I think we are, for example, on the topic of personal protective equipment, we're well positioned to manage through for the next few months and longer, assuming that the supply chain continues in the state that it is today and this thing doesn't grow exponentially in size from where it is today. We don't have a research capacity, so we're not at the front lines of researching new ideas, but we're going to have the rapid COVID test shortly. We're going to be doing the plasma program also, plasma replacement program also. So as these concepts come to the fore, then we get in line and move forward. I'm fortunate that we have an amazing medical staff. Many of them practice at other facilities in the Sugar Land, Fort Bend community. So I think we share a lot of protocols and try and use the best we can from everybody.
So that's a really good segue into my next question. When you talk about sharing information with folks, is there a network here in Fort Bend, and how does that work amongst the hospital systems and needs, learnings, sharings? And I'll let you, Seleria, start, and then we'll go to the other panelists.
Absolutely. Well, within the, what kicked us off, that we quickly had to mobilize, I think, as a medical community, as far as reaching out, as far as our TMC collaboration. A lot of that communication kind of started just because of the resources available. And even at the local level, being able to network with our colleagues around the Fort Bend community area. Many of the doctors, as well as our clinical staff, work between the hospitals. And so being able to mobilize and talk about best practices was, I think, a real great opportunity for us to quickly learn. We talk about sometimes fail fast, and that fail fast means that if that's not working, we convert to something else that will help us better take care of our patients. So I think there's constant communication and collaboration within the community. There's not a collaborative. I think we are close enough and there's enough networking where we just naturally mobilize when we need to be able to do that, and particularly when it comes to what we've had to deal with the PPE and the testing, and even patient location, and where there's enough bedding to support the needs for the community.
Dr. Torres?
Certainly this is a situation where we have to be prepared to make a change at any time. It could be tomorrow we have 20 patients. It may not happen for 3 months. We're going to have to be prepared for that. Certainly getting into the ramping up right now, trying to get these patients taken care of that have been a backlog for the last 2 months is very important. And trying to make sure that patients understand that we've tried to make our environment as safe as possible with temperature checks and universal precautions, masking. All those things are important. That we've tried to communicate all this information on a daily basis to our physicians and our hospital staff. As we met, we had our incident command for the hospital itself, but our division of CHI certainly had a daily phone call as well, talking about what we're doing as our division in Texas to unify and help bolster our ability to make changes, because we were using information that came from the medical center as well from our division leadership as well. So we were able to garner that information together and have a daily phone call. So I spent an hour every day, Monday through Friday, on these phone calls, trying to make sure that everybody understands what changes we're making and how to address something that's come up. But a lot of time has been invested into making sure that once we have these deliberations, that information is spread out to our physicians and hospital staff, so they know that every day we're trying to make up-to-date changes to meet the demands or the new challenges that come up for us. I know that Memorial Hermann has a network the same way that sends out messaging to all their patients, because I'm on staff there as well. Methodist has the same thing. HCA has the same thing. So we're all trying to get that information out. And I'm on staff, so I get to read what other people are doing too, but it's good because it helps us understand where we're at. Are we all on the same page? Are we doing something that maybe we can improve on ourselves in the hospital? So we're trying to put this information. I know CEOs are talking to each other as well. All our counterparts are talking to each other to make sure that we're all on the same page as far as how we're trying to make our patients feel safer. But I think that education for our staff, for our physicians, and the community is really at the basis of the trust that we need to develop with our patients, because that's the trust that we're going to depend on to have them come back and to the hospital if they need to have them come back to our offices to see us, to get back in line with their the needs for their chronic care illnesses and follow-ups. So I think that information hotline, which we really need to improve for our community, because I think we have a ways to go there. Nationally, you have news feeds from different areas talking about what Dr. Fauci recommendations they're making, but I still think we need to translate that information that he gives us into English, as it were, or understandable English, and what that means for the individual. What the vaccine, it's coming, how long is it going to take, why is it taking so long? I think we have to make people understand the concepts of what needed to be done to accomplish that, and appreciate that and be patient. And I think patience is the one thing that we all have to develop more of, and our patients are going to have to develop that as well. And it's going to be upon us to try to give them as much information as possible to make them feel as comfortable as possible in the situation that we did not ask to be in. And it's difficult, but we're going to be, that's the rest of our challenge until we get a vaccine, is to make sure that we are putting that information out in a manner that they can understand.
So I'm going to go to the chat. So this is a question for, well, Joe, I'll ask you. How quickly can your labs deliver testing results? And then what are the immediate needs of your hospital currently?
So we are awaiting our rapid COVID test, which will allow us to do a COVID test within a few minutes. Right now, we're using LabCorp, and their turnaround time is a couple of days for a COVID-19 test. Our biggest need is staffing. We are experiencing a surge of COVID cases as we speak. We're at 21 confirmed and suspected cases, 11 of which are in our ICU. So we're looking for ICU nurses pretty aggressively, because we have, at the same time we have all those COVID patients, we have other patients that still need hospitalization in an intensive care unit.
I'll allow Seleria, then Dr. Torres, and then there are some other questions here in the chat that I'll get to.
Okay, so very, very similar. We are already using the rapid testing. The rapid testing is available with a fairly quick turnaround, within a matter of hours. But we're being cautious in using that, because we only get so much allocation for those type of rapid testing. And then we are testing our other scheduled cases, and when we have opportunities on our normal testing, that has a turnaround time around anywhere from 24 to 48 hours, sometimes up to 72, depending on the demand. I would say that certainly that's been helpful for us in being able to expedite, the procedures and the things that our patients require. Very similar. We're filling up. We certainly are ramping back up on our surgical volume, which is excellent for us. At the same time, living in two worlds where we have our normal patient volume starting to come back into the hospital, and so balancing the two, just for the sake of taking care of the COVID patients and all the things that come with the safety measures around that, as well as we bring in other patients that are kind of in that unknown category. It just takes a lot more time. So staffing is always our top priority, because that makes sure that we have the safety that we need. I really feel we're at a good spot, though. We really have kind of planned some of the daily calls that happen daily. We've been ramping up to this point, to the fact of when the governor was able to ease some of the restrictions. So it's allowed us to be prepared at this point. We remain vigilant on supplies and other things that we know, because we don't know what that future is going to look like. We want to be prepared. And so our day-to-day conversation is around our supplies, our staffing, what resources are there that we need, making sure that our teams are ready to go. So it's just an ongoing conversation we continue to have related to how we stay prepared.
Thanks. Dr. Torres?
Well, when the patients come to the emergency room and they're suspected to have COVID, we can get those tests done through Baylor St. Luke's within 4 hours. So we have that available to us. Our outpatients that are getting procedures done are all being tested. We're now testing every person that's admitted to the hospital without COVID symptoms. They're being tested. Those are going to CPL. Those we get within 24 hours. It's located in Austin. That's where they're doing the testing at. But they've been very good at getting us our results within 24 hours. So we've got good relationship there as far as what we need for our patients. Certainly expanding the testing that's rapidly done at Baylor is difficult because, as Ms. Seleria said, that certainly there is a limit of those supplies available to us. And until we're able to do our own rapid testing, going to remain where we're at until that expands, which has been our limitation all the time. But we're now doing, every person that gets admitted will get a test done so that everybody is safe, as well as our outpatient procedures and stuff as well. So long term, that's going to be a major challenge, is to make sure, how do we ramp it up and make sure that the tests are a good test, not just for the sake of doing a test, but really that the results mean something to the patient, and that we're not worried if there's something missed, as has come out of the news recently. So we're trying to be safe with our patients and making sure that we take care of their interests and that we're safeguarding our employees and our patients as much as possible. So the future of testing is going to, all of us is going to be very much affected about that. And obviously the ongoing PPE needs is certainly something else that is there in the, we're out there, have adequate supplies now, but what's going to happen a month from now, 2 months from now? And one of the other things that's very interesting, and I'm sure that anybody has patients ICU's experience, is now we're seeing shortages of medications that use for sedating patients on ventilators. So that's another challenge that we have. So medications sometimes have been a challenge. With the onset of the use of convalescent plasma, that's given us another tool to use for these patients. We are involved in some clinical trials through Baylor St. Luke's with remdesivir and some other protocols that are being used. But only time will tell how helpful that's going to be. But the more information we get now, the better are prepared if there is another wave, another spike in patients. But the convalescent plasma has been something that's been grown through the blood center. Gulf Coast Regional Blood Center is now collecting and asking patients who have had COVID and are healed and well from that to actually donate convalescent plasma to help other individuals. So that's been on the news as well, but certainly something that we need to encourage our patients to do, that they can help other people that come down with the COVID illness.
Another question from the chat, and I'll start with you, Seleria. Have there been any cases of the rare COVID-related inflammatory syndrome for children in the area?
Yeah. So for the rare symptoms that are seen in children, we have not seen it here locally at all within our pediatric unit. We do have a pediatric bed, including up to IMU level pediatrics. We had a few cases that came in where parents thought perhaps that there were some respiratory, perhaps there was some COVID exposures. We did test those kiddos, and fortunately they were not positive cases for us. So we have not seen that here locally. Throughout the system, there's been some suspicious cases that did look like they were more of that rare kind of multi-symptom things happening with our children, but no confirmed cases. Just a lot of respiratory related illnesses that we're just keeping a close watch on. But definitely our pediatric services here locally, they've just not had those cases, but been able to treat the pediatric children as they've appeared with other respiratory related illnesses.
Thank you. Dr. Torres?
We don't have any pediatric patients, but what we do have is the Family Birthing Center, which has been a great concern with young mothers coming in to deliver and finding if they are COVID positive. and then the steps that have to be taken afterwards with the birth and separating the mother and the baby. So those safeguards are very important as well. You certainly don't want your newborn baby to be exposed to this kind of illness. But it's been a challenge, but we're testing all those patients before they deliver to know where they're at. But when they're there in the hospital, certainly that's a challenge that you have to be able to meet.
Joe?
We have not had any cases like that.
Okay. There's a question here. What processes have you put in place during the pandemic that you expect to continue once we're back to our, quote, normal routines, i.e. limited visitors taking temps? And I'll start with you, Joe.
I imagine we will be screening patients, visitors, staff, and doctors for the foreseeable future until the vaccine is widely available and herd immunity has been acquired. Other practices that I imagine will continue is more people working from a remote site, since we have found we can, through Zoom and other tools, be effective working off-site. In fact, we found in some cases we're more efficient working off-site than on-site. So I think that will continue. I think we'll gradually relax restrictions on visitors and things of that nature as we find ways to protect ourselves, our patients, and our visitors. I think we'll continue to see more tools like Zoom meetings, which we have found to be a tool that optimizes our ability to bring multiple people together without having to go through some of the difficult hurdles of pulling people to single locations. So those are just a few of the things that I foresee, but more I'm sure will evolve over the course of time.
Seleria?
Yes, I would say very similar. I think that the practices that we've had to put in place, we found to be helpful with some of the social distances, some of the work from home opportunities that would allow for more efficiency. I definitely think that's a bit of a win for us. I think that really the safety measures that we put in place in some ways have been an enhancement. So some of the rigorous sterilization and cleaning and just making sure that we are making sure things are clean. It's just what we do every day, but it's just been enhanced more than anything. I do see in the future, for right now, the visitations, there will be some limitations there. We'll do that just for the safety of everyone, our patients, our employees, those that are here for care, but hope to in the future, again, see that open up some more so that we can, we know that there's a healing process often that comes with family members being able to be there for their loved ones. So we can definitely anticipate a different normal, but a safe normal for sure for our patients, family members, physicians, and everyone involved.
Really good. Dr. Torres?
So I agree that I think the temperature screening and masking and social distancing is going to go on for a while until we see a definite change in this virus and that a vaccine is available widespread. So I think that's going to be around for a while. I really do agree that the WebEx, the Zooms, all the video discussions that we've had have shown us that we can do more without meeting in the same room. I think actually being with other people is helpful too, but it's a way to interact and get ideas from people you might not because they're not able to be there physically. So I think that's hopeful. I've done video chats with my patients and they find it very helpful, especially when it's a check-in. I mean, we see patients for their physical, obviously that has to be done in person, but for their check-in, how their blood pressure is doing, what their sugars are doing at home, how well their diabetes is being cared for, they're having other symptoms. It's a good way to check in on patients. They feel, because we're seeing face-to-face and it feels like the person is right there in front of you, they do feel comfortable. You get an idea what their environment is like. And I think it's helpful to get more insight into your patient. The better you know them, the better you're able to take care of them. So I think that the video chat, for some people, if they're capable of doing that's going to be very helpful, and I hope that will continue to stay. And the WebEx meetings, I think it's been shown that more people are able to work from home for many types of jobs. Obviously in the hospital, there's a lot of things we have to do hands-on and training and things like that. But I think that there is a lot of lessons to be learned from doing these video conversations. And I hope it's something to here to stay, not to say we don't need in-person meetings, but certainly as a replacement for the majority of the meetings that we have now.
So we're getting close on time. There are a lot of big thank yous coming in. So I'll express that to you guys. Then there's a lot centered around expectations associated with reopening and as that unfolds. So maybe as we close, address that and then add any closing remarks that you feel comfortable or feel necessary. So Seleria, I'll start with you.
Yeah, absolutely. Expectations are really, I would ask, our community, our physicians, our employees is really just patience with us. We've all experienced a lot over the last few months, certainly learning how to deal with this virus, learning more about what is it going to take to be safe or at home, at work, or if I'm at my local grocery store. So I think it takes a lot of patience. So as we begin to move people back into the healthcare organization, they're seeing their providers, they're coming in for procedures, just recognize it may take a little bit more time. It may take a few more questions that we have to ask. We're going to ask these things and ask them to comply with us, again, with the mask and the temperature checks for the safety of everyone involved. They may recognize that our waiting areas are not as available for everyone in the family, maybe to sit and stay with the patient for the procedure. It may be limited, but those are things that we're going to just ask as we ease back into kind of a normal state, that we are putting those safety measures in place, not out of inconvenience for anyone, but just simply to provide the safety that it's going to require for us to be able to function. We want to be open. We're doing things like virtual visits with our patients so that they can see their family members from home. And those are things that we found to be really helpful to our patients and that our family members have appreciated. So a lot of more technology where we can use technology. A lot of patience when it comes to being able to take time to go through those extra tests, questions that may be asked of them, and then just really being able to acknowledge and support the fact that we are doing things a little different. And all of it is in the spirit of trying to be safe and trying to ensure that we can provide the care that we need to provide to those that need the care. Again, in closing, just to say, our EDs, if we have emergencies, we want to be able to see those patients. If they need to see their providers in the office, we want them to be able to see their providers in the office. Any surgeries, we need to be able to do that, but it's just going to take a little bit longer planning, a lot more calling that we're doing on the front end, just to get them prepared for when they come in the door. So we certainly are excited about where we are today, proud of the work that everyone has done, and look forward to our future opportunities just working together as a community and as a healthcare organization.
Thank you very much. Dr. Torres.
Hi, first of all, I want to thank our community for being so supportive of all of our institutions. That has been a great deal of help for our employees. They know that they have the support not only of our administration in the hospital, but the community as well. And we really do appreciate that. And I want to thank our staff for being so diligent about trying to follow all the rules and regulations, which were much more than we ever thought we were going to ever have to do. And certainly having to tell someone that they can't come see their family member, that's a hard thing to have to put on someone's shoulders. But yet we've asked our physicians and our nurses to do that, just that one thing. And we certainly want to do whatever we can to try to allow at least one visitor per person on a regular basis and find a way to do that, because as Seleria said, this is certainly an area that we know that there's healing with patient's family, and there's less anxiety with a patient when they're in a different environment. So trying to keep our patients safe is at the top of our listing to do, and certainly educating our patients. But one of the things I think that is vital is that we make sure that the patients are getting information from a place that is trustworthy, and that they're not hearing rumors about tests or treatments, and that they're getting their information from a trusted site. And I think that's very important. And to keep a close eye on changes that are being made. So we're trying to make sure we get that message across. But if you have to log onto my website to do that, that's not a good thing. But trying to make sure that you're at least aware of what's going on and using trusted news sources to be able to get that information from. But I feel that our hospital is ready to take on the increased patient loads from our outpatient testing and patients with other illnesses, heart attacks, strokes, those kind of things. We're ready to take care of those, as well as those patients that actually happen to come in with COVID symptoms as well. So we're going to have to be able to take care of both of those patients with equal ability and safety. And I want the community to know that we're prepared to do that, and we'll do whatever it takes to make sure that that happens in a safe manner.
All right, Joe?
Well, to the question of reopening, right now, the tool that we have seen that works to prevent the spread of this bug is social distancing. And you can look as close as different states in the country and as far away as I saw an article today. Hong Kong and Singapore combined have a population of 13.3 million people. Between the two of those cities, they've had 27 deaths from this COVID pandemic. And they were affected early on in the progression of the disease. And the way they've done it, they can't truly social distance because they're too tightly packed. So an artificial form of social distancing is masking up when in public spaces when you cannot maintain that 6-foot distance. And you've got countries like Sweden and Germany that have various forms of managing it, but all of them rely on isolating those that are ill and trying to prevent the spread as much as possible through extensive tracing of people who have come in contact with COVID positive patients. So there is a pathway where we can resume semi-normal practices, we can reopen our economy, but we all have to understand we don't have a vaccine, we don't have tools in our toolbox that if you get sick, we have a high probability that if you have to be hospitalized, we've got a process to fix you. We don't have it yet. We have several different promising opportunities, but nothing is got enough data behind it that we can say with a high degree of assurance we've got a medication or what have you. So staying well is the thing that I would encourage everybody to do as much as they possibly can. And we will get through this, and as I say in my daily video, and we'll be stronger for it.
Really good. Thank all of you. This was great. I think a lot of awesome, smart information. So as we close, the Chamber wants me to call attention to a couple of dates. June 3rd at noon, we'll have our 4th in our medical update series. That'll be next week. And then May 28th, which is tomorrow, there's a Precinct 4 update with Commissioner DeMerchant at noon. And if you're looking to access more events, there's a list on the Chamber's calendar online. Last, a big thank you to our sponsors again, CHI St. Luke's, Sugarland, CU People, Fort Bend Medical Society, Memorial Hermann Sugarland, Houston Methodist Sugarland, and Seyfarth Shaw. Thank you all so much. We appreciate you. Stay safe, stay healthy, and we'll see you next time.
Thank you.
Thank you.
Thank you.
Thank you.